the age of 35, I had a cardiac event. I was at home with my two children, who were 2 and 4 at the time, and we were getting ready to go on an Easter egg hunt. I was feeling completely normal that day, and I went up to change my shoes. And when I stood back up from slipping my shoe on, boom, I had chest pain straight through the middle of my sternum and straight to my back. It concerned me, and it was nothing less than severe. I went downstairs because I was actually worried that I might pass out and the kids were downstairs. So when I went down the steps, I had a sensation that was something that I had never felt before. It was from the top of my shoulders to my fingertips in each arm simultaneously, and it was almost audible in my ear. It went whoosh, whoosh, and it was just a jolt of pain. I knew at that point that something was completely wrong, but decided to sit down for a few minutes and wait for my husband, as I knew he was coming home in a few minutes. Then I started to feel short of breath. When my husband came, I told him I was having chest pain and I felt really short of breath. Within a few more minutes, I started to feel clammy, and my husband decided we'd be calling 911. The original physician told me that maybe it was a lab error and that maybe I had a panic attack. This didn't sit really well with me, and I started to feel very uncomfortable because I remembered the pain that I just had that morning. I decided at that point that I was going to be my own advocate and I was going to keep track of my labs. This is when I first met the first cardiologist that I had seen, and when he walked in, he asked me to explain what happened the previous day. I explained my symptoms, and he started explaining to me about how young women can have panic attacks and sometimes they feel tightness in their chest. I explained to him that this was not tightness, that this was chest pain. I then stopped him and asked him what about my troponin levels. The doctor said, "I'll be right back," and left the room. When he came back, immediately he said, "You're getting cath. Yes, your troponin's elevated and those are a cardiac marker." I never saw that cardiologist again. During that time, there were several staff members that came in to see me, such as nurses and the hospital physicians. And nobody would really tell me what my diagnosis was or if I indeed had a heart attack. They just weren't saying it. I went down to the cath lab. The staff, I just remember they were on the left side of me as I was laying on the table, and they were just trying to make me comfortable. And they were talking about my kids and asking me where I lived and talking about preschool as the cardiologist started the procedure. And then all of a sudden it got unbelievably quiet and nobody was talking or asking questions. The conversation just ended. At that time, the cardiologist stopped the procedure and he knelt down to my face and he said, "I'm sorry, but I can't fix this here. I've never seen this before in someone your age, and that I would need surgery."
Holly is one of those remarkable women who was able to really understand what heart disease means in women and how to approach it when you develop symptoms. Holly developed symptoms that were new for her. She developed chest discomfort, radiated down her arm. It was something that she had never felt before in her life, and she knew that this was not normal for her body and to call 911. That was one of the most important things that Holly could have done to save her life, is actually to take action and recognize symptoms. In women, the symptoms sometimes can be a little bit different. You can have shortness of breath, you can have back discomfort, upper GI or abdominal discomfort, extreme unexplained fatigue. All of these things can be presentations of heart disease, and recognition is one of the most important things. The other thing that I really appreciated about Holly's story was the fact that she was not afraid when she was in the hospital and people were saying to her, "This is probably not a heart attack, this is probably not heart disease, this may be anxiety, this may be spasm," to say, "I think it may be my heart, and what about my troponin levels? Don't they suggest that there's something wrong with my heart?" And she was not afraid to challenge and get the answers that she needed. She was really taking control of her health in a way that made all the difference.
His diagnosis was that I had an aneurysm in my right coronary artery, and that it had possibly dissected and produced a blood clot, which caused the heart attack. Having open heart surgery was nothing that I expected to have at the age of 35 with 2 little kids. After having a home health nurse and a physical therapist for about 6 weeks, I moved on to cardiac rehab. When I first started rehab, I was the youngest patient in the class, and most of the patients accepted me almost as a grandchild. They were in different phases of life, and I had 2 small children at home. It was a challenge mentally and emotionally. It was hard for me to relate to where they were in their phase of life. When I started rehab, I was very fearful. I was fearful that I would have another heart attack. I was fearful that something was going to happen. But going through the rehab at McConnell allowed me to gain my confidence and also allowed me physically to rehab my heart.